Welcome to another video about how to revise for our GCSEs. Now, in this video, we're going to look very quickly at what diabetes is and how the body behaves if someone is a sufferer of either type 1 or type 2 diabetes. In the top left-hand corner, you may see a diagram that, if you have seen previous videos, is a bit familiar to you. This diagram is a negative feedback loop, and it explains how the body responds to changes in blood glucose level in the blood. Blood glucose level in the blood. That's pretty obvious. And it talks about the effect of insulin and the effect of glucagon on that. Now, what we're going to look at in this video is what type 1 and type 2 diabetes are specifically. Now, as a disclaimer, there are other types of diabetes that we do not need to know about, including things like gestational diabetes, which occurs in some pregnant people. But we're going to focus mainly on type 1 and type 2, as those are the ones that your exam board has specifically asked for you to know about. So diabetes is when the body is unable to control blood glucose levels. Now, that's a very, very broad definition, and actually it's unlikely that you'd get a general definition, but if you can keep that in your head for when we go through the next sections, then that's going to be really useful. So what we're going to do is, for each of the types of diabetes, we are going to think about what specifically is diabetes in each case. What effect does it have on the body, and why is that dangerous? And lastly, what are the treatments for each type of diabetes? So type 1 diabetes is where the body does not produce enough insulin. And if you watched the previous video, you will know that insulin is vital for bringing down blood glucose level after meals, for example. If the body is not producing enough insulin, then blood sugar is too high. And if blood sugar is too high, there is risks of, first of all, directly after meals, a person having lots and lots of blood sugar. There is the risk of sort of almost manic episodes, but being on a real high. There is also the risk then that later on, as that blood sugar is not being stored as glycogen, it is excreted, and then somebody has what we call a hypo, which is where their blood sugar levels get very, very low. And that obviously has an impact on the amount of respiration that a person might be able to do, which then will impact on the other processes that the body can also conduct. Now, treatment for type 2 diabetes is, first of all, monitoring diet closely. Now, diabetics will always be thinking about what they eat. They'll be thinking about whether or not they need to eat something between meals in order to maintain their blood sugar levels. They'll be thinking about whether they choose to eat different foods, if that's going to give them a spike in glucose levels, and they'll constantly be monitoring it using some sort of blood glucose monitor. Now, some of those are actually embedded into people's arms, for example, but some people use by doing a prick test, where they take a small sample of blood onto the monitor to look at their blood sugar levels. The well-known treatment for diabetes, if the body is not producing enough insulin, then type 1 diabetics tend to inject insulin. And injecting insulin literally is replacing the insulin that the body is not producing on its own. Now, type 1 diabetes tends to be something that people have from a very, very early age. It has genetic links, and it is normally caught quite early because sufferers will realize they've got it quite early because the body is not producing insulin, so those effects become quite obvious. Type 2 diabetes, though, is slightly more difficult to diagnose because it isn't necessarily something that you will observe in younger people, although it's becoming more and more frequently diagnosed in younger people recently. Type 2 diabetes is when the body is no longer sensitive to insulin. Now, it isn't as simple as saying the body no longer detects insulin at all, but it's almost become a little bit insulin resistant. And if cells are insulin resistant, it means that even though insulin is being produced, the cells are not taking up more blood glucose as would normally happen, and so there's therefore more blood glucose there. That means it's going to be excreted. It also means that less glucose is being stored, and so you can see similar symptoms to type 1 diabetes. So like I said, the effect is that less glucose is taken in by cells or stored. And again, that can give you your symptoms of high blood sugar, but also the hypos where blood sugar levels drop because there isn't that blood glucose stored as glycogen. Now, treatment of type 2 diabetes primarily is about lifestyle choices. It's about eating less sugar, but also eating less carbohydrates. And carbohydrates are important to consider as well because carbohydrates will be broken down into sugars in the body by enzymes. We can medicate with insulin, but this will only happen if the lifestyle choices that should be made are not having the effect that they should do. Another thing that we can do for type 2 diabetes, type 2 diabetics, I should say, is to look at their general health as well. Type 2 diabetes is heavily linked to things like obesity, and so for type 2 diabetics, if they are being put on a treatment plan for their diabetes, there'll often be some form of treatment point in there about losing weight or getting down to a healthier weight, so that the body can improve its resistance it reduces resistance, I should say, to insulin. So that's type 1 and type 2 diabetes. Type 2 does have some genetic links, but primarily is caused by lifestyle choices. Type 1, genetics. Type 1, your body isn't producing insulin. Type 2, it is producing insulin, but your cells have become insulin resistant, often due to increased levels of glucose in the blood over a sustained period of time. If you want to learn more about how blood glucose is controlled in the body, please do have a little look back at my previous videos because there is one in there on that. Good luck and keep revising.